sir, Judge, that was it.
All right, so we'll go ahead and get started, and I think we're going to hear first from, I believe, Dr. Walks, if you're all ready to go, and then we'll hear from APH and get some other updates. And I just first want to thank you, Dr. Walks, for everything, all the work you've been doing this last week. Also want to give a thanks to Dr. El Salde and the Austin Independent School District for the actions they're taking to keep kids in Travis County and Austin and our region safe. Thank you very much. And I think the last thing is, well, I'll turn it over to you, Dr. El Salde, before I start, or Dr. Walks, before I start talking too much. Thank you very much. And we're joined here by Commissioner Trevelyan.
Thank you, Judge. Appreciate it. Good morning, everyone. We are going to talk about where we are right now as far as our COVID response. Next slide, please. This is a look at where we were on Sunday with regards to case counts, numbers of admissions. Next slide, please. And here we were yesterday. We had 445 confirmed cases, a 7-day moving average of 83. 551 patients in our hospitals with COVID, 191 in ICU, 116 on ventilators, and we had 74 admissions and 56 discharges. And yesterday we were down to 2 ICU beds. We're a day behind on the DSH's reporting for ICU bed availability. And so the next slide, please, that looks at our overall TSAs in the major metropolitan areas. We see that this is based on the day before. Austin TSA had 14.58% COVID hospitalization, and Houston had 16.2. Dallas was at 14.37. San Antonio was at 16.95, and El Paso was at 4.4. And you see the corresponding number of ICU beds that were available in each of these areas. I want to point out that if you look at the metropolitan areas served and the populations, that number of beds that you see corresponding to each of our areas is very small. And at this point, transfer between areas is difficult, if not impossible. So this was the genesis or the reason why we asked for our community to take all precautions, stay home, just go out if they were doing essential functions, wear a mask, and get vaccinated. Our next slide, please. We see that we're still lower than the other counties that are listed here with regards to the number of cases per 100,000. Next slide, please. Next slide, please. And if we look at our hospital admissions by age group, we see that we're having a steady increase in the numbers of cases, with the highest percent change and increase occurring in the 30 to 49-year-old age group at 450% increase. Next slide, please. And this is showing again that admissions have increased across the age groups. Next slide, please. This slide is showing our admissions by race and ethnicity, and we see that 76% of admissions have been whites, 40% of that is represented by Hispanics. Next slide, please. And if we look at the county of residence from which our admissions are coming, 54% of our admissions are from Travis County. And the next highest county that's supplying patients to our hospital systems is Williamson County at 22%. Of the 579 reported admissions that were in the last 14 days. The next slide, please. You'll see that almost all of our admissions have been due to people who are unvaccinated or partially vaccinated and therefore unprotected from COVID-19. We know that we have 88% protection from the Delta variant by being vaccinated and over 90% protection from severe disease, ICU admissions, and death by getting vaccinated. Next slide, please. To look closer at what's happening in our pediatric population, the slide looks at the numbers of pediatric cases that have occurred since the beginning of the pandemic to present. And we see that there were increases in pediatric admissions during the two spikes or surges that we've had in the past, back in June and July of last year, and earlier this year in the January, December timeframe. And we're seeing that similarly occurring at this point. If you look at our next slide, please. Hospital admissions have increased in our pediatric population July over June. We had a total of 11 admissions to hospital in June, and that's risen to 34 in July. Next slide, please. And this looks at our IC admissions, and similarly, there were 12 admissions in July, much higher than those that we saw in June, representing over 1,000% increase. Next slide, please. And this looks at our admissions since the pandemic began. Our numbers in 2020 were 139, and since January of this year to present, we've had 222. Next slide, please. And if we look at our admissions by age in 2020 and to date 2021, we're already tracking to have a higher number of admissions. Right now we're at 7,400. From March to December, we had 7,000. So we're starting to see that increase. And we're also seeing that the numbers of admissions that have occurred in the age 10 to 18 year old age group has historically been higher, and that's proving to be true again this year. And next slide, please. We're looking at the percent positivity rate broken down by age group, and remembering that when we're at 10% positivity rate, we're in a period of high transmission. And in our 3 to 5 year old age group, we start at 10% and then work up from there. There are higher positivity rates that we've seen in the past and higher case numbers in our teenage population, and that's what we're seeing here on this slide as well. Next slide, please. Looking at another vulnerable population group that we've been tracking over time is our senior citizens groups in nursing homes, and we are seeing that there are cases developing in that group. 66 cases in the last 14 days, 128 in the last 28 days. The good news is that there have been few hospitalizations that have been needed in this age group because they've been fully vaccinated. So that they're experiencing mild illness that can be managed in the nursing homes. Next slide, please. I want to go back to our children, which is top of mind for many of us. And this looks at school reopening with taking into account what would happen if we were dealing with our previous variants of COVID. That the next slide, please, shows where we are if we look at the Delta variant, as it's much more infectious. I want to take a minute to talk about the infectiousness, how infectious this virus is in the variant form of Delta. It has higher viral loads in the pre-symptomatic phase, which means that people who may not know that they're yet sick are carrying high viral loads, which means that they can be spreading the illness before they know they're sick, which is why we've asked people to wear masks whether they're vaccinated or unvaccinated. This becomes particularly important in our school systems because children who are identified as positive cases and their close contacts are both important, because the close contacts, if they're not identified and isolated, may in fact be carrying virus and not know that they're sick. And so the importance of contact tracing cannot be overstated. This graph talks about our ICU capacity. The line that you see across the bottom with ICU capacity written on it marks our 200 bed mark, which is what our current ICU capacity is based upon the staffing that we have available. Our hospital systems are doing an excellent job of adjusting patient volumes and capacities, moving staff from their usual positions to new positions to help load balance. They're also not performing a lot of elective surgeries. They're performing surgeries that are needed because patients are sick, acutely sick. So they're doing all that they can to make our capacity work for our community. But it is imperative that we improve compliance, which you'll see written on those top bars at the top of this graph. And compliance includes wearing a mask, getting vaccinated, staying home, just getting out for essential things, and if you do have to go out, wear a mask. Everything that we can do at this juncture to bend this curve downward is going to be important for our community, and particularly for our children. So masking is important, and I stand in support of both masking and contact tracing. Next slide, please. And this is the Delta variant, and you see that it's more infectious with projected outcomes of much higher numbers of cases. Next slide, please. This is a slide I showed you a few weeks ago, and I'm just showing it again to reiterate the importance of what we've done so far. We must get the unvaccinated vaccinated to prevent cases from rising. We have high transmission rates in our community, and unvaccinated people should stay home so that they can protect themselves from becoming ill. And we have to wear masks to prevent the spread of COVID-19 from people, between people who may be asymptomatic and therefore spreading. And next slide, please. Just to give you a little information on where we stand right now with our progress toward herd immunity. We've delivered we have 698,666 people who are fully vaccinated, and based on our overall population numbers, not just the people that are eligible for vaccination, which we know we have a large segment of our population under the age of 12 unprotected until we have vaccine available for them. We now have 55% of our population protected fully by vaccination. 7% of our population are confirmed, have confirmed COVID-19. 14% is our estimated value of the number of people who are undiagnosed in our community with COVID-19 and have some level of protection. However, let me stop and provide the caveat that 21% of individuals have what we think is limited immunity to the Delta variant because the antibodies that are produced by those who have had COVID are thought to last for a limited amount of time. So it is important for those who have had COVID and have not had monoclonal antibody infusion therapy to get vaccinated. If we look at our partially vaccinated group, there are 9% of individuals who are partially vaccinated. It's important for them to complete their series of vaccinations. And then we have 15% of people who are vulnerable. And it is my fervent prayer that they will go and be vaccinated so they can be protected against COVID-19 and we can get to the other side of this surge. And with that, next slide, I'll end my report. Thank you.
Thank you, Dr. Walks. Adrian Stirrup, Interim Director for Austin Public Health, and I will now give a brief update on our vaccine operations. So the staff at Austin Public Health continue to respond to the surge. In terms of media, last week, as you're all aware, we held a KXN town hall with Dr. Walks and area doctors to answer questions and talk about the current stage that we are in. We also made our announcement of moving into stage 5 on the 5th and had a media availability following that announcement. We have worked to increase our epi-response staffing. We're working on increasing our call center capacity. We're expanding our testing options. One good thing about this that folks are listening and they are getting tested if they feel sick. So right now we have mobile testing available as well as operations at the Dove Springs Rec and the St. John's Old Home Depot for drive-through. We successfully opened our larger isolation facility and we have a 50-bed capacity that will come online pretty soon here. And recently we received support from the state to help establish our regional infusion center. And before I move to our next slide, I just want to take a moment to thank the staff at Austin Public Health. In the media, there's a lot of talk about the need to protect doctors and nurses and medical staff because they're tired, and I am fully in support of that. But I know that the folks at Public Health have worked tirelessly since February. And to see us going into surge, there was that look of despair, but then right after that was the resolve and the determination to continue to go full tilt to serve our county. And I just want to publicly say that I see you, I appreciate you, and I feel honored to work alongside of you. As we talk about how we need our community to respond to the surge, the recommendations are clear. We want you to follow the guidance on the chart and to break it down even further, get vaccinated for the long-term protection of yourself and your family. Wear your mask because while vaccination is important, that's not what's going to get us out of this surge. You need people to wear their mask, whether you're vaccinated or unvaccinated. And if you're not fully inoculated, we need you to stay home and wear your mask when you go out for those essential activities. As I mentioned earlier, we're continuing to ramp up our testing options. We have the 2 static sites that are already established at the Dove Springs Rec and at St. John's. We have in-home testing that's available if you call 311 or 512-974-2000 to get an appointment if you're homebound or unable to access a testing site. And we're also continuing to support our long-term care facilities and shelters and other congregate living situations that need testing. When we take a look at operations for the last period, the last week, we see that our weekly dose count is continuing to improve. We were really having low numbers over the past month and a half, but now we're seeing an uptick in that in terms of people seeking out vaccinations. When we look at the data for the county broken out by race and ethnicity, um, incremental improvements, but still seeing gaps in our Black and Hispanic communities, much in line with what our caller referenced. And we will continue to use this data as well as the data represented on this map to fine tune and expand our options or operations rather for vaccine and community. And again, the pie charts show the information a little bit differently when you compare the eligible population, which is 12 and over, with the population that has received at least 1 dose. You see the disparities represented by the gray shaded area for the Hispanic community, and then by the orange shaded area for the Black and African American community. And those gaps persist with the percentage of the population that is fully vaccinated. When we look at our geographic data or our top 8 zip codes, again, seeing some incremental change in the data. Of note is 2-4. That was our highest percentage of change over the last week. And so we will continue to persist partnering with the Travis County Collaborative and other community organizations to push in vaccine wherever we can. Here, our slide shows our static operations at Southeast Library, Little Walnut Creek, and the Anna Lark Center, as well as the Del Valley Opportunity Center that we operate in partnership with the county. This week we'll also be at Turner Roberts. And if you visit us at www.austintexas.gov, you can find out where else we'll be. In addition to these operations listed here on the screen, our mobile team is scheduled to be at 21 events, providing vaccine in different places. Bergstrom Tech, Pathways at Meadowbrook Apartments, Street Youth Ministries, Austin Couch Potato, Gardner Betts, Del Valley Middle School, Elgin High School, Cedars High School, LBJ. So you can see we're in a variety of different places. So if you want more specific information about any of those locations, please visit us at www.austintexas.gov. Efforts continue in terms of messaging. On the screen, you see a nice screenshot of Dr. Walks at the KXAN studio, as well as her colleagues on screen. And we continue to push out messaging via social media. Why do you wear your mask? And you can see it there represented in different languages. In terms of upcoming events, on the 13th, we will have another episode of My API Live, which is a Facebook event targeted for the Asian Pacific Islander community to have candid conversations about COVID. On the 14th, we'll have a PPE and food distribution at the Montopolis Community Center. And what's all the buzz these days is the soft launch of our gift card incentive program. And so right now, the gift cards are available at through vaccinations administered by our mobile vaccine program. This weekend, we expect a full rollout with gift cards available at any of the APH locations. It's $50 per shot, and all we're asking the public to do is to fill out a short survey after each appointment to be eligible to receive that vaccine. Thank you.
Thank you, Director Stirrup. Do we have the Travis County Collective Team, Chuck?
Judge, yes, Chuck Brotherton, County Executive for Emergency Services. This morning, y'all will hear, as usual, from ESD 11 Fire Chief Ken Bailey and Constable Precinct 4, Constable George Morales. I'll turn it over to Chief Bailey.
Good morning. This time I'm going to try and actually share my slides. Ken Bailey with Travis County Fire Rescue representing the collaborative. We will be brief along with Constable Morales will follow. As of last night, the vaccine collaborative for the county has delivered over 25,000 shots. That includes about 7,200 of those shots occurred at the Expo Center, and the remainder are in these mobile pop-up events. We currently have performed or have planned through the month of August 287 mobile events. The total, if you include the work at CODA with community care, is now in excess of 100,000. We are seeing an increase in interest in first doses. In fact, the first 8 days of August represents about 40% of all the first doses that we did for the month of July. And for the commissioners, I know there's some discussion about the expo, and Chuck Brotherton has this slide. I think it's been forwarded to you, breaking down what has occurred at expo, and I think that's a topic for another discussion, or a discussion for another time. We have also broken down by location. The expo represents about 28% of what we've done outside of CODA. Manor is the second largest event, which was really hammered with the mayor of Manor and Dr. Smith, and Del Valley Independent School District has also played an important role with us in trying to address some of the issues on the southeast corner of the county. I'll now turn it over to Constable Morales.
Good morning, Commissioners, Judge, Councilmember, and Mayors. We continue to focus on our outreach and education, doing work that would ensure that our strike teams are successful. This last week of the first week of August, we did about 1,900 phone calls and 1,100 flyers to homes in our communities. Our mobile vaccine teams did a combined shots of about 1,650 shots this last week. We were able to identify some locations that were provided for from our outreach folks that we kind of made sure that we could more coordinate, like for restaurants and businesses like Pollo Loco. And we encourage a lot of folks to call our office. Our number is, let me see this right. It's 512-854-7468, 512-854-SHOT. And this is for a home vaccine request. And what we're going to do is get on the ground. We actually have teams on the ground now. They encourage our shot locations. They start at 8:30 in the morning. This is cooler. And we're flying homes and talking to people and getting to the locations where the shots are available. The 854 shot number is because this came up in several conversations with our outreach folks, is there are families who can't get to the location. There are residents that have people that are homebound or due to disability or something other than that. People who want to keep themselves safe due to having multiple family members around them. And then the big one for me was people who would like to keep their vaccine private. So that was very important for us. So as we continue on moving forward for this week, we do have shot locations like at Langford Elementary, Travis Crisis Ministries, San Juan Diego Catholic High School, Wells Branch Community Center, working with Commissioner Shea, River City Youth Foundation, the Mexican Consulate, and that's still pending for dates and times, Houston Tilson University. We had a successful weekend this weekend. I want to, like I do every week, I want to give shout outs to a lot of people that were boots on the ground with us. PARG staff was amazing this weekend. With additional help, we were able to funnel 20 people at a time, utilize social distancing with masking, gave out 3,200 bottles of sanitizer, almost 12,000 masks to families. County Judge Andy Brown, Commissioner Margaret Gomez, Councilmember Vanessa Fuentes, Commissioner Jeff Trevelyan, Commissioner Ann Howard, other elected officials, Trustee Julie Nitch. Hopefully I don't forget everybody. If I do, I still apologize. Judge Bradarrutia. I mean, a lot of people put a lot of work in this weekend to keep a lot of people safe. And I want to wholeheartedly thank you for that. Again, we're going to continue to push forward to our mobile vaccine collaborative. You heard the chief say we have over 200 clinics set up this month, and we're going to continue to try to serve as best as we can. I'll take any questions.
And Judge, I'd just like to follow up and add a little bit more information, as I did last week, about where folks can look to find vaccinations in their neighborhood. Just want to share a couple of websites, so I'm going to share my screen. Stand by, please. I apologize. So we've got websites, Travis County's website, traviscountytx.gov, or a quick Google search for Travis County vaccination will lead you to this page that shows you a day-by-day calendar for all of the various pop-up locations that we have scheduled. And I'm hopeful you can see that. But today, August 10th, you can see how many we've got. You click on any one of these. Most of this is really a combination of both county collaborative and Austin Public Health, but you can also see some others in here, HEB Pharmacy, Walgreens, and so forth. But click on any one of these and you'll come up with the details, the location, the types of vaccine available, hours of operation. The same calendar is also linked through austintexas.gov/COVID-19, and you can find the information that Director Stirrup pointed out, and it also does link back to that daily calendar. And for folks who would like to get a vaccine at a private pharmacy or a grocery store, vaccines.gov is another great resource for just finding locations for where vaccines are. Click on the Find COVID-19 Vaccines, enter your zip code, and you'll quickly come up with a number of CVS, HEBs, other private locations for vaccinations. As you heard from Director Stirrup, as well as Chief Bailey, APH has been averaging about 1,300 doses a week at their pop-ups since April 1st, and the collaboratives starting our pop-up operations, we likewise have been averaging about 1,300 vaccinations a week. So we are continuing to do good work. We're working to expand our efforts, and we want everybody to be aware that these opportunities are easily and readily available every day of the week. We would like to point all of our residents to get a vaccine. And I'll stop there, and we're prepared to take any questions, Judge.
Awesome. Thank you, everybody. So we'll do the normal thing. So we're going to go first the Commissioners Court members, then the judge.
Judge.
Yes, sir.
One question. My office has gotten several calls that said evidently they had called into the wrong line, and we've now reached out with the right line. Is it possible to let public comments occur before we start the questions, or it could be after? But I just want to make sure that we hear some of the folks who are wanting to partner with us and help us along the way.
Sure. Larry, how many callers do we have on right now?
Judge, just at the moment, just one.
Okay, yeah, let's do that, because I think we closed the period, but it sounds like this caller had the wrong number, so we can open it back up for this one caller. If you don't mind, Larry, going to the caller.
No, not at all. Janice Bookout is on the line. Janice?
Oh, thank you so much for including me. I really appreciate it. I just wanted to say first, I wanted to start with a huge thank you to Travis County. When you look at the map of the vaccine, all the dots on the vaccine map on the Travis County page, they're all in East Austin. And I just want to say thank you. That's a remarkable change, and it's I just really appreciate it. And also I just want to acknowledge the bold leadership at AISD, who yesterday passed a mask mandate. They did the right thing for our children, even though it wasn't the easy thing and they took a big risk. So I wanted to go on the record as saying those two thank yous. I also wanted to say great job in 78719, because 78719 has been lagging in vaccinations and having increasing cases, but they are now the fastest increasing in vaccinations throughout the county. And then I also, two more things. I just wanted to say, right now, 787-214153 and 17 have very high rates since July 1st, and they have very low vaccination rates. They have the lowest vaccination rates of all the zip codes. So I'm concerned about those in particular. And I also just wanted to say I think it might make a real difference if we considered allowing clubs like music venues to have music late, like to change the sound ordinance so that people could be outside with music until 1 a.m. instead of having to go inside to play music at clubs at 10 p.m. I've discussed it with some of our scientists on our team, and they feel that might make a real difference in our rates. So I wanted to offer that as a potential option for policy change. Thanks so much for all of your hard work, and keep it up. Thank you.
Awesome. Thank you, Janice. Thanks, Commissioner. All right, so we'll go ahead to the question.
Judge, pardon me if I'm sorry to interrupt you, Judge. Excuse me, I'm sorry to interrupt you, but we do have a second COVID caller if you wanted to take it.
Sure.
This is William Kirkendall. William?
Yes, it is.
Please go ahead, sir.
Good morning. Thank you for the opportunity to visit with this group this morning. I'm calling in support of your efforts and the request that we increase our outreach to young citizens and those who are tepid in receiving the vaccination. We don't want another shutdown, but the risks are apparently quite high, and allocate the resources that you deem appropriate in order to protect our citizens and your constituents. Thank you for this opportunity to speak. Continue the hard work.
Right on. Thank you very much. All right. Okay. I think we're going to go on to the question part. So we'll do commissioners and then the county judge and then council members and the mayor. That would be the order of questions. And I know we all have lots of questions, but if y'all could try to limit it to one so that we could get through this. So I'll start with Commissioner Gomez. Do you have any questions?
Judge, not any question. I think it's pretty clear what it is that we have to do to kind of cut this off. However, I don't know what we're going to do with those folks who just refuse to take the shot. And I guess we're going to have to be satisfied with that there's going to be a certain number who will never do it, because we certainly have gone out. I know that the constable and the ESD team have gone out and talked to people face to face. And I mean, you know, those are people that you could trust. And yet we still have resistance. I don't know, I don't know what the answer is to that, except I guess somebody told me that we probably had to just require it of everybody. And I don't know that we're going to go there. But I think we just have to keep plugging at it, I guess, and try to turn things around. But thanks very much.
Thank you, Commissioner. Commissioner Brilliant.
Okay. I'll start off by thanking the public health departments and also the constable's office and our ESDs who have been creative about getting out and talking to people that sometimes have difficulty talking with government. I think it needs to be said again that a lot of the issues that we are experiencing are structural issues. Uh, we're dealing with communities that unfortunately have not been served well over the years. And even when we started off, we were a little, it was sketchy. The first, it was 10 weeks before we actually started getting into community and testing. And then when we had vaccinations initially, um, I'll say this, it's ironic. Um, we had to get Dr. and Mrs. Delco shots at the Round Rock Express Center because they couldn't get into the Delco Center. It seems crazy on its face. So we have to understand that some of the issues that we are addressing are structural, and we have got to find a way to continue reaching inward and outward as well to our trusted partners. I think one of the reasons that the Constables program is so effective is that he is a trusted community partner. He grew up in the community. People know him. They come to the gym in his neighborhood. That creates it's not just it is competence, but it is also trust. It is also, I know you and I know that whatever you're telling me I ought to do, I should participate in. We have to continue to make that type of outreach across the communities, particularly in the Eastern Crescent. I think that as we have worked with churches, we have worked with, so I've put a whole lot of effort seemingly to get. Only way that we're going to get that response is to give the tools that are necessary to our trusted community leaders and have them work in the communities that trust them. And I think, when we talk about having those leaders identify spaces that we should be working and then have other trusted community members actually, but we just have to continue to work there. It seems, it might seem like we are at a diminishing marginal effort, but I think that what we have found over the last couple of weeks is our numbers have begun to rise a little bit. People are beginning to trust a little more. As we create community events, as we focus on things that are going to be coming up, back to school days where we're giving out backpacks. When the season starts, football games, basketball games, we've got to go where people, because they have a lot of reasons not to trust us. And they're not recent. They are historic and structural. So it might seem frustrating. It might seem not to go as fast as we want it to, but it will be absolutely necessary to get to the point that we ultimately get the herd immunity. So thank you for what you're doing. I just want to, the question I'll ask is, how close have we gotten to getting the personnel into the budget that the constable asked for, so that we can actually start calling and knocking on doors?
It's a great point. Chuck, I know we added, I think, 6 people to the team last week. I think we may be discussing that in our separate meeting under the COVID item more today, but any updates there?
Hiring process is underway for those 6, identifying the appropriate candidates and bringing those folks in. That is all in the works, and we're working it as fast as we can.
I appreciate that. I wanted to continue to encourage the staff, because we're dealing with structural problems, and the only way to address that is continuously letting people see you do the right thing for them in their neighborhoods, and then they'll begin to trust us more and participate with us.
Right on. Thank you. Commissioner Howard?
Thank you. I wanted to just appreciate Dr. Walks when I saw her busy last week and taking the time to give high school physicals to young ladies and men out at LBJ. It was, you're doing the right thing, and I appreciate it. Thanks for being out in the community. I would just echo the question is, do we need more people? Are there any other partnerships, that we could put to work between now and football season and basketball season to make sure that we're covering the ground? So as people are working in the community, if there are other partnerships we need to explore, please bring them forward. Thank you.
So let's see, just wanted to see, Director or Adrian, if you wouldn't mind looking back at the slide where you said how many shots I think Austin Public Health and Community Care had given. It was like 1,000 or something. Does that number include what George and his team are doing? And then separately, is there a way to see basically week by week how many people are getting shots in Travis County, overall at private providers, as well as the efforts that we're doing? And it's probably somewhere really obvious that I'm not looking at, but is that a thing that we could track week by week, just how many vaccines are being given within Travis County by all of our efforts?
So the information that I shared were shots specifically delivered by Austin Public Health and Community Care. I believe through our partnership with Mr. Brotherton and the Constable, we can give a collective presentation of those numbers week over week. And I believe on the DSHS website, we should be able to get that information for the county. But if that is information that you would like to see, the team and I can work to provide that in future presentations.
Okay, yeah, that'd be great, because I think everybody's doing great work on it, and I would love to see if the things we're doing, it seems like they're working better and better, and we're getting more shots out because of obviously a lot of factors, but would like to track that number pretty closely. Thank you so much. And Mayor, I will pass it on over to you.
Judge, thank you. Colleagues, I think today we're going District 1 through District 10. So we'll begin with the Mayor Pro Tem.
Thank you, Mayor. Thank you, Judge and Commissioners, and everybody who's worked so hard. Constable Morales, I am constantly in awe of you out in the community doing the good works, and so I couldn't be more grateful that we have a member of our community like you. So you and all your effort. Dr. Wilkes, I think you said something earlier. Walks, I'm sorry. You said something earlier that I'm wanting some clarity on. So you were talking about, specifically, it was the slide where we talked about ICU capability. And I think in the capacity, like it had, capacity, and it was 2 and, several numbers. And you talked about basically how I think you said transfer is virtually impossible. I'd like for you to elaborate on that some, if you wouldn't mind. And then if I also may, as an extension of that question, I'd like to know, are we going to find ourselves like we were in that first surge, where we're going to have to be looking at setting up secondary emergency medical facilities?
Yes, so right now, because we have, we're maxing out our ICU bed capacity, we are having to load balance, and there are people that are waiting for beds in ICU, in emergency rooms, because we don't have enough staff to expand our ICU capacity. And this is a phenomenon that's come about because we have had people working on a response to a pandemic for 19 months now, and some people have retired and some people have moved on to different careers, and it's difficult to find staffing. So this is not just happening here, it's happening all over the country. And we have, in particular in Texas, similar situations in our major metropolitan centers where tertiary care, ICU care, ECMO services, high-level care is available. And we are, we've been able in the past to accept transfers from other cities and out of state. And now, because we're taking care of people in our community at this level, we don't have the ability to accept transfers. And the same is true in other cities. Occasionally you may have an opening, but for the most part, we're all experiencing high surges in cases, and so we're not able to transfer. As to whether we're going to have to open another facility, we could open another facility, but would we be able to staff it? And at this point, we want to set that resource in the place where it's best used, and that would be in our hospitals. So right now, we're trying to support our hospitals and their ability to withstand the surge that we're experiencing.
Thank you very much. I appreciate that.
You're welcome.
Thank you, Councilmember Pfeiffer.
Thank you. So first I want to say thank you so much for sending the text alert and the phone call over the weekend discussing the severity of the situation that we're in right now with the surge. I think that was super helpful, and I was really glad to see that come through. It certainly sparked a lot of conversations in my community. So I just wanted to reiterate my gratitude for utilizing our tools to get communication out to the community as quickly as possible. And thank you, Dr. Walks, for joining the Awesome Latino Coalition meeting and discussing with our community members the process for the testing for the Delta variant and what that looked like and how nuanced and complex it is. I really appreciate your participation in that meeting. So my question is, I have a few questions. So the first one I wanted to talk about is the social media efforts. Can you, Director Stirrup, can you share a little bit about if we're engaging in social media ads that are geo-targeted to certain areas that we know are low vaccination rates, or at least, sharing out our testing center information and the testing process? Do we have social media ads running?
So I know in the past that we have used ads. So though all of our posts, anything that we put on social media, as well as our texting platform, uses geofencing to target specific populations.
Thank you. And I would just like to encourage us to start running social media ads that are hyper targeted as much as we can, and putting I mean, it's an inexpensive way to get information out there and have it targeted to a population. So that might be a tactic that we employ with a sense of urgency, just given the severity of the situation that we're in. The other question I had was around the incentives. Thank you for sharing about the HEB gift card. I'm happy to see that. I do think we should consider additional incentives. You know, the scholarship, full scholarship for students, I think is a great way for us to target that demographic, and particularly that age range where we know where we have lower vaccination rates. And so just want to encourage us to continue building on our incentive package. I think it's a good next step. But I do think we'll need to elevate it if we want to reach that tipping point and getting more people encouraged to take the vaccine. And my last question is around PPE, knowing that we are encouraging everyone to mask up indoors and outdoors if possible. And we have, you shared the one PPE drive that's coming up in Montopolis. Are there other efforts around our PPE distribution? How are we doing on our supply? Do we need to increase our stockpile? What more can we be doing when it comes to getting out masks to the community?
So in terms of supplies needed for community distribution, we have plenty. The team has worked on a calendar of events through the end of this month, and I will be sure to share that in its totality at our next briefing. So at one point we were kind of standing those down, but with the recent surge and to support the messaging that and the recommendations from the health authority, we are picking up those opportunities to distribute PPE to communities.
Wonderful. Thank you.
Thank you, Councilmember Renteria.
Thank you, Mayor. All I just wanted to say is thanks to all the people that have been out there working, getting people vaccinated. You know, it's getting to that point where it's real sad that we're seeing so many people in our hospitals, which could have been prevented, but it is what it is. So I just hope that people really take this really serious and go out there and get their vaccination. I know I even have a nephew that has a young boy that's, you know, he's 11 years old and he refused to take that vaccination, even though he knows better and he knows where to get it at. He still refuses it. So I just hope that he'll come to his senses and go out there and take that shot, not just for himself, but for his child too. Thank you, Mayor.
Okay, Councilmember Kassar.
I want to thank Austin Public Health and the collaborative, especially for what you've been able to accomplish in 78617 and in the 44 and the 24 of getting sort of here in the last week more than double the number of vaccines in those communities as basically in the city as a whole. It goes to show that those targeted efforts can make a big difference. And I just want to offer my help in 5-3 and then obviously I think all of us also in the other zip codes where you're getting closer to doubling the amount of vaccine uptake there, but there's still a ways to go. So I think really 5-3 and 4-1 and 5-2, but two of those are in my district are kind of the next biggest low-income zip codes where we still are under 60% first dose. So it goes to show that I think y'all can take this from a game of inches to a game of yards by really targeting those zip codes. I'm glad you're getting 2% or 2.5% of people every single week. And I think it'd be really great if we could get to that 2% or 2.5% every single week in those other really high need zip codes. So please do let us know how we can help.
Thank you. Councilmember Kitchen.
I don't have well, I do have one additional question. First, let me just echo what everyone has been saying about vaccination, and I'm very pleased to hear the efforts that are being made to reach out to people personally. and appreciate the efforts the constables are making and everyone is making in this regard. I do want to circle back again and ask about the nursing homes. We had some conversation about this last time, just wanting to understand if there's any update on that. And that's regarding any requirements that the nursing home facilities may be putting in place with regard to their workers being vaccinated. Can you just, can someone update me on that?
I'm not aware at this point of that requirement being made. I actually have a meeting after this one to have an update on the long-term care facilities, and if I get that information, I will be sure to get it to you.
Well, if they're not, what I'm really wanting to understand is what actions are the nursing facilities taking to encourage, incent, or require their workers to be vaccinated. So that's really what I'm trying to understand. So perhaps after your meeting, you can just provide us, you can send us an email with an update. I'd like to understand their latest thinking. I know it's an evolving question about the actions that nursing facilities may take. I'm also curious about it because there was a special task force created at the national level last year to look at best practices for nursing facilities. And I'm not certain what came out of that with regard to best practices related to vaccination of staff. So I'd just like an update on that. Does that make sense, the question I'm asking?
Yes, ma'am. Thank you.
And I would say that we should wait for Dr. Walks's full report out, but what I'm hearing is that staff are being asked to voluntarily disclose if they are vaccinated, and then if not, there's a certain type of mask that they can, if they are, there's a certain type of mask that you wear. If you are not vaccinated, you have to test twice a week now because we're in stage 5. So it was once a week and now it's twice a week. And then you have to wear that higher level protection of masking when you're dealing with clients. But we will get a comprehensive look at what the different facilities are doing and report back to you.
That's great. Thank you very much. I know you mentioned some aspect of that when we talked last time, Ms. Stirrup. I'm wondering if there's any data at the moment about the effectiveness of that kind of approach. So if there is, if you would share that also.
Okay, thank you. Councilor Kelly.
Thank you. Thank you, Austin Public Health and Dr. Walks, for all the work that you're doing. I also want to thank Mayor Pro Tem for asking about staffing at hospitals earlier. I know that we're talking publicly about a surge in COVID cases and ICU bed capacity, but it sounds to me like staffing is a major factor in regards to the lack of available ICU beds. Dr. Walks, I'm wondering if you could help us understand what is being done at hospitals to ensure that we have the availability of staff.
They're making inquiries across the country for staff to come and work at our local hospitals. They're trying to get staff from other areas in the country, but that's difficult at this juncture since this surge is occurring across the country.
Okay, thank you. And I'm not sure if I missed it, but were you able to answer the questions that I sent in last week? I didn't see an email from you about that.
I forgot to do it.
Okay,
Sorry.
thank you. That's okay. Thank you so much.
Okay. Councilmember Poole.
Morning, everybody. I wanted to draw everybody's attention to the dashboard that shows the zip codes with the prevalence of the surge for Delta. And I'll note it's 78660, which is Pflugerville. Could Dr. Walks or Director Stirrup speak to that? What's
Sorry,
going on
I didn't hear your
with
question.
flu?
Can you say it again? I was writing down to remind myself to answer Kelly's questions.
Great. Yeah, if y'all look at the dashboard and go to the highest new cases, the weekly highest new cases by zip code, and open up that map, you'll see that the highest prevalence of new cases is 78660 zip code, which is Pflugerville. They're head and shoulders above everybody else. And I just wanted to point that out. Our Pflugerville friends, is it that they need to go get vaccinated? Do we know what's going on in 78660 and why the surge is so high? Because it's going to be affecting us in the other southern zip codes below that. And so I want to urge our Pflugerville friends to take responsibility.
I do know that DSHS reached out to our vaccine teams last week to talk about zip codes of concern, and 78660 was one of them. Even though they're showing high percentage of folks fully vaccinated, because it's so large, there were higher numbers of people who were not vaccinated. So they were kind of looking at the data on that granular level. And they asked us to make sure that we thought about that in our efforts and make sure that we stepped up our presence there. And so we are currently working with our partners in Pflugerville to reestablish not only a vaccination site there, but if need be, additional testing resources. I can get back with the team to see if the folks at DSHS pointed out or gave any insight to any other factors they thought were driving those numbers, and either include that in the next presentation or respond to the council and commissioners via email.
Thanks. And my appreciation to everyone in all the other zip codes who are doing what is socially and civically responsible and getting their vaccinations and wearing their masks. And I would urge our friends in Pflugerville to do the same. Get those numbers down. Thanks.
Commissioner Poole, real quick, I want to make a real quick comment about Pflugerville. Pflugerville ISD has already been working with us and our collaborative on trying to get that. And Adrian will share that responsibility together. Also, Black Hawk Community Center is a focus in the Pflugerville community, along with ESD2 and Foothill Farms, Travis County building.
All the more reason for Pflugerville really to dig in and do the work, because clearly we are supporting them in every possible way. So Pflugerville, go get your jabs. It's your job. Thanks.
Thank you. Councilmember Ellis?
Thank you, Mayor. Can we get some advice on outdoor events and activities? I know Blues on the Green was just canceled, but I know there's a few more things that may be happening, as well as kids being outdoors, playgrounds or sports. So can you speak a little bit about the need for masking outdoors, if there is one, and what considerations people should have for that?
I've been working under the assumption that transmission is not as high in outdoor settings. However, there have been some reports of transmission in large groups where people are unable to socially distance. And we also know now that there is some asymptomatic transmission that occurs from vaccinated individuals. So we are asking people to mask when they're in outdoor settings that don't allow for adequate social distancing from people that are not in your household. And we are looking at the impact of having large gatherings on our community's case numbers, given that we're in a situation right now of high transmission in our community. And we're evaluating events on that basis and making recommendations. As for playgrounds, again, masking is something that will protect particularly children who are unprotected under the age of 12.
I appreciate that. I know when I'm outdoors, I still apply the same rules about social distancing and want to make sure I'm taking every precaution I can, even though I'm fully vaccinated. I still know that it's possible to spread things. So I hope folks, take that to heart and provide for that distancing as much as possible.
Okay, thank you. Councilmember Tolo. Can't understand you, Kathy. With that high-pitched squeaky thing. Let's go on to, need to go on to the next one while you call in or something. Councilmember Alter, let's go to you.
Good morning. I want to first, acknowledge the important step that AISD took last night to require masks. And I want to thank our staff and the county staff, because when I called one of the trustees to say how important a step I thought that was, the first thing out of their mouth was what a wonderful collaboration between the county, the city, and the school district to keep our children safe. So I'm really happy to see that coordination happening. And I know that Dr. Walks played a big part in helping them to understand the science. So I wanted to acknowledge that. I think that is one of the key steps we can do for one of our most vulnerable populations is to require those masks in schools. And as a parent of a vaccinated child in school, I know that I feel a whole lot more comfortable about the start of school next week with those precautions in mind. I wanted to ask if in future presentations for what's now slide 6 that has the COVID-19 deaths per 100,000, if you can move the key because we can't actually see where we're at to compare each other because the key is over the lines. That would just be helpful to be able to see that. And then I wondered if you could speak a little bit more about the breakdown of hospital admissions sort of from out of the area and how much that is contributing. We have those numbers for hospital admissions. Is it the same breakdown roughly for ICUs or is it skewed? Trying to understand, given that we can't have transfers and other things going on and we have a larger hospital system, at what point would we understand if we are having more influx from outside or if this is all from our community? That's my first question.
The slide that I showed showed that 55% of the admissions are from Travis County, 22% from Williamson County, and then it's broken down between all the other counties after that in smaller amounts, less than 10% from each one. And the same is true for ICU admissions. I've shown that slide in the past. I didn't put that on this week's slides, but I can add that next time. And it's predominantly coming from our county.
Okay, and just in terms of the way the hospital systems function, 55% seems like it's obviously that's a majority coming, but it's not 90% from our county. I just don't know how the hospital systems are set up to function as to what is a normal breakdown across the counties.
Well,
and part of the reason I'm asking is we don't control what our neighbors do, but inaction by the governor does affect other counties. And I'm trying to understand if there are, additional spill on into our county that are present in the hospitalization numbers from that inaction.
I don't know the answer to your question. I do know that we are a Central Texas collaboration. We are part of the Central Texas area, and we provide care to people that present to hospital. And the rural areas do not have hospitals that can support and care for people at the level that we can in our county. So it's important that we continue to be able to maintain our structure and to provide the service to our neighbors in neighboring counties.
And obviously we need to be able to provide the services to whoever presents themselves the best we can. But I'm trying to understand the degree to which, the actions that are happening in other counties are impacting our ability to provide the healthcare that's needed in our community, understanding that we, broadly speaking, have a particular role being more urban and having more hospitals. But we don't get to control the messaging. We don't get to control those things that are going out in those communities. And, we're all connected, and we have to recognize that. And we have to, understand sort of the consequences from there. And then my next question, I think maybe for Director Stirrup, in what we've talked a lot about sort of the things that the state has made it difficult for us to do with respect to mask mandates or vaccine mandates or occupancy limits and other things. In what ways is the state actually helping us to manage the situation, whether it's financial or policy or support? I want to be positive about the things that they are helping with, but I'm not hearing about them.
And so I know just over the weekend, we did get support from them for the Regional Infusion Center, and that will be huge for our community. The second thing, hot off the press yesterday, is that they've pledged support for locals in terms of hospital staffing. We're still waiting to see how that's going to roll out. And so there has seemed to be a shift in the stance with respect to assisting with resources.
Great. I'm really glad.
Yes.
I'm really.
Go
ahead.
I was going to say glad and grateful. So yes.
Yeah. Well, I'm glad and grateful that there's that shift. I wish it had come sooner so that we could have avoided the surge more. But I'm glad to see that it's there now. Thank you.
Thank you. Councilor Tobo.
Thanks very much. How's this?
Good.
Good. Thank you. I didn't catch all of what you said, Councilmember Alter, but my guess is that you were talking about the AISD board meeting in some of your comments. And I just wanted to also thank Dr. Walks. I had an opportunity to catch some of your presentation last night and just concur with my colleague that the information you offered, I think, was extremely valuable to the conversation they had. And I too want to just give a shout out to AISD for protecting our students throughout our district and our teachers and the staff at those schools by requiring masking. And really, I'm just very glad to see our schools take that stand and appreciate the work that our city staff and county staff have done to really collaborate and work with them. Thanks to all of our staff who continue to work on this critical situation. I have a variety of things. I'm going to try to isolate them down. I've noticed there are differing messages about quarantining and when it's required, including for students in our schools. And so I think, we're seeing some information come out of TEA, we're seeing some information coming out of AISD, and then some individual AISD programs have some slightly different information. So to the extent that you are continuing to work with them, getting really clear information out to parents about what people should do when in terms of quarantining and other kinds of situations would be super helpful. To get back to what Councilmember Ellis said, we have several large outdoor gatherings coming up. Dr. Walks, you said you're evaluating them. Is there any intent to encourage some of those large gatherings to do things differently, to consider not moving forward? What kind of messaging are you working clearly with them on messaging if those events go forward? And then the same question about messaging applies to our restaurants and bars, which have an ability to impose mask requirements. Are you working with them and reminding them of their ability to educate? And educating them and reminding them about their ability to impose such a requirement. So big events, and then how you're working with some of our local businesses to remind them that they have an ability to require that. I happened to be in a store just last week, and one of the customers was asked to put a mask on, and And he responded that it's against state law for them to ask him to do so, which of course is not true. So I think making sure that our local businesses know that they have the ability to require customers to wear masks is really important.
Yes, we've had conversations with the business community to ask them to support our efforts at improving mitigation strategies throughout our community, and particularly in our business settings and in restaurants. And they've been supportive and have pledged to help us get that done. As for large gatherings, we're in conversation with organizers for those various events and discussing mitigation strategies, and in some instances, maybe making some changes as far as timing goes to ensure that we're not having a deleterious impact on the community spread that we have right now.
Thank you very much. And I hope it was clear. I was saying, I know you have worked with businesses throughout. I guess I was wondering whether you were doing kind of additional work with them right now, or do you feel that most have what they need and understand what their rights are at this point?
The last time that I spoke with somebody from the chamber was on Saturday afternoon. So that's the most recent conversation I've had.
Great. Thank you very much.
Thank you, Councilor Tovo. I want to reiterate, as everybody has, appreciation for the work that's been done by the city and county staffs, the constable, the chief. As we all know, because we all see it, and the community needs to understand, these are folks now that have been in this 24/7 drill now for such a long period of time, and the effort continues unabated, and it is just so appreciated, so incredibly necessary, unfortunately. But I just want to add my voice to the appreciation and thanks to everybody. I think the work we're seeing right now on the numbers, Dr. Stirrup, with respect to the zip codes, is encouraging. I mean, those were all areas that were lagging significantly. There's still a lot more work to do, as we can see. And some of the zip codes, about half of the target ones, still lagging, but doing so much better than they've done in the past. And some of them really show the focused and concentrated effort. And I know that it is harder as you get into this door-to-door campaign that you're doing, the constable and chief and everybody's working on. It's harder. But I think that you're finding the right formula now and the ability to be able to expand that. If you need more resources to be able to do that as well, make sure you come back to the council because it's working even incrementally. I also want to add the thanks and appreciation and kudos to the school district, AISD, for stepping forward. You know, at some level, regardless of whatever else is happening, we look to our school boards and our elected officials, their trustees and superintendent, to do what's necessary to protect our children. And now, having seen the advice from the CDC and the American Academy of Pediatrics and the renewed calls by Dr. Fauci and so many others to make sure that our children in our schools are masking. We expect our schools to take care of our kids, and then figure the rest of it out later. And I appreciate what our school district did, and I hope Dr. Walks and I know in talking to Judge Brown that we're going to do everything that we can do to help support that kind of action and put our shoulder to that as well. Kudos to Dallas that took that action. ISD, kudos to Houston that is considering it, I think, on Thursday of this week. I just think that it's just really important for local communities to be able to step forward and assert that kind of liberty and freedom interest that is associated with local communities doing what's necessary to protect themselves. I also want to thank the governor and appreciate the action that the governor has taken to help us stand up that monocultural facility in our community. It's something our hospitals have been asking for. Being able to move that facility out of hospitals and into a centralized space will help us with some of the staffing issues, as we're able to take staff that was devoted to that in our hospitals and put them toward other patient care. So that is appreciated. That's something that we had last go round that worked really well. It didn't look like it was going to happen again, but the decision just made for that to happen, we appreciate. And then the news last night that after our hospitals had something like 20 some odd STAR requests, which are the requests that hospitals make in the state for assistance for staffing. They had all been turned down a week ago, Friday. When we got word last night that the governor is apparently willing and offering to help in this regard with staffing. And just as I am critical when the governor's office puts up roadblocks for us being able to help get more of our community vaccinated or masked, I want to make sure that we're thanking him and his office when they're doing things that look like they're going to help. That all said, we need more people masking, and we need a message to our community that's unequivocal about how effective it is to mask. That masking is the best way we can keep our businesses and our communities open and vibrant. And the inability or roadblocks in terms of mandating that sends an ambiguous message to our community as to whether or not it's important. And again, I think it's critical that local communities have the ability to be able to do that. This is a pandemic right now of the unvaccinated. We need more people to get vaccinated. We need to get, as Commissioner DeBrey was saying, more trusted voices out in our community with the facts and data, so that more people move in that direction. That's ultimately the way our society will be able to function in the future. But masking is critical right now because vaccines will not help us with this surge. People have to wear masks. They have to wear masks indoors and outdoors. Whenever you're around somebody that's not in your family group, you should have a mask on. I probably have stared at these numbers like everybody else, like way too much. But and on the new medical call we had yesterday, there is perhaps, if you squint, early evidence that behavior changes are in fact working. And people are beginning to see maybe indications of masking behavior changing. And you can look at some of the slides that you have presented here today. One on 10 that might indicate a trend that might be working in our favor. So I just really encourage the community to double down on that, triple and quadruple down on that, because that's what it's going to take to change things in our community. The slide of the German study indicates that if people mask, we can flatten this out. And clearly that's what we need to do. I would add to the list of people that we are thanking those businesses in the community that are stepping forward and using the power that they have to be able to make decisions about their own enterprises and their customers, what is accepted behavior and their employees, because right now that is our most effective measure. Kudos to Blues on the Green for stepping up and postponing the last two performances that they had. That is not an easy thing to do. Kudos to restaurants like the Headliners Club that have announced policies to only let people that are vaccinated in their locations. Kudos to ACL, whose concert this weekend was only for people that were vaccinated or could prove that they had a negative test. Kudos to organizations like Good Work Austin that is pulling together their collection of restaurants and merchants that are going the extra mile to help keep our community safe. Adam Orban with Locadoro, one of the leaders in that effort. Thank you to big employers and small employers, including Facebook Austin, that are adopting policies to ensure that everybody in their workplace has to get vaccinated. And manager, I really do want us to figure out what we can do and judge what you can do with city and county employees as we're asking other employers in the city to set those rules and those expectations and to incentivize that work among their employers. I think that we need to lead by example. This is a critical period of time. Nobody wants to go back to the lockdowns that we had before and close our economy, but it, quite frankly, is up to us at this point. A year ago, the enemy was the virus. That's not true anymore because we have answers to the virus. Right now, the enemy is the status quo and our inaction. And the good and the bad news of that is we can actually do something about this. And now is the time to do that. With that, Judge, I'll turn it back over to you.
Thank you so much, Mayor. And yeah, very much want to thank Dr. Elizalde and the AISD board for their leadership. And also do want to thank Governor Abbott for what sounds like an agreement to start paying for increased staffing in our hospitals. And so I hope that does come through. That will obviously really help. All right, so with that, I guess we're going to adjourn for about 5 minutes. We'll come back at, how about 10:50? So 10 minutes to 11, we will come back and
okay.
Yeah.
It does something that is good, we should acknowledge it. He's done enough bad that has hurt our communities. So I do appreciate his beginning to understand that this affects families and children. And we need him on the right side of history, not the wrong side.
Absolutely. Right on. Okay, thank you. So we will adjourn till 10:50. And Mayor, I'll pass it over to you to do the same.
Sounds good. Thank you. With that, here on August 10th, 2021, times 10:45, we're going to adjourn the city council portion of this meeting. Let's take a little bit of a break I've been asked to do. We'll reconvene at 11. We're going to hold the city council meeting, the general session. We're going to convene there, but immediately go into executive session, which is the only thing that we'll be doing today is the executive session. It would be best if we had a quorum with me at 11 so that we could then move into executive session. But I'll see you there then. With that, our portion of this joint meeting is adjourned.
Entitled, it's all so unfair.